Well, hello everyone, and welcome to the latest episode here on RNFM Radio. You could be watching or tuning in live with us today on a Google Hangouts on Air. This is, of course, June. Yes, the month of June. It's summer and quite steamy hot here. Now, June 18th, 2014, and this is episode 118. We have an awesome guest that we're going to be bringing on here momentarily. But first, I need to let you know how and where you will be finding us. And of course, that's going to be on rnfmradio.com. That's where you can find out everything and anything about Keith and myself, and of course, our wonderful guests over there, because we're always hanging out on the Pulse of Nursing, and that's exactly where we are, because the Pulse of Nursing is everywhere you want to be. So we're always under the hashtag RNFM Radio, and that is under every social media platform you can name: YouTube, Google+, Facebook, Twitter, LinkedIn. I'm exhausted already because there's so many social media platforms, but we're out there because guess what? Wherever you are, that's where we are. Now, of course, you can find us over our partners over ProMed Network at promednetwork.com/RNFM Radio. We're also proud to be over at TuneIn Radio and Stitcher Radio. And for all of the Apple's fans, and maybe not Apple fan, you don't need Apple to have iTunes. We're also over there on iTunes under the podcast section. So again, isn't it amazing? We're everywhere you need to be. And of course, right now on Google Plus, on a Hangout on air with our wonderful guest today. And of course, as always, we'll give you a roundup of the upcoming guests here at the end of the show. Oh, and one quick little tidbit there. Remember, you can call or text us at 720-466-3022. Now, my wonderful guest, or I'm sorry, my wonderful co-host, and as rock star as he is, this is how rock star he is. He's back with us right now, and you didn't even know this, and I have to share this. He forgot his power cord to his MacBook Pro, and so he literally had to leave his studio, run up the road, and get a cord. This was just less than 10 minutes ago, and here he is back already. Speedy Gonzalez, how are you today? Of course, Keith Carlson, he is here with us today in Santa Fe. How are you today, sir?
Hey, Kevin. Hi, everyone. Yes, I forgot my power cord, and my computer was down to, 2% power, and I ran down the street to Dot Foil Computers here in lovely Santa Fe, got a power cord, and I'm back. And I'm so glad I made it back for the introduction of our wonderful guest. So thanks, Kevin. Yes, and it is episode 118. We're here live with you today, and we're really excited. So why don't I introduce Vivien, Kev?
You go right ahead. Vivien wants to be introduced, and she's so excited, just bursting at the seams to come on the show today. So
All
go
right.
ahead, my friend.
So I am so happy to introduce Vivien Mudgett, RNCMA-MSN. She's the CEO of Healthcare Leadership Coalition. She is a seasoned nurse executive with over 25 years of progressive management experience. She's passionate about subjects that affect healthcare providers today, and she's an expert on disruptive behavior, the Affordable Care Act, and leadership in healthcare. The Healthcare Leadership Coalition exists primarily to educate, inform, and empower healthcare professionals and consumers as well. She connects her readers and clients with information related to healthcare change, communication, dealing with bullying and disruptive behavior, and transformational healthcare leadership in a turbulent time. And that is the 21st century in a nutshell. She is well known as a national speaker, a member of various organizations, including Sigma Theta Tau. She holds a master's in educational leadership and a master's in nursing, and she's currently enrolled in a doctorate program because she has so much spare time. You can find Vivien at healthclc.com, and on Twitter she is Mudgett, M-U-D-G-E-T-T, and she's also on LinkedIn. So Vivien Mudgett, welcome to RNFM Radio.
Thank you, Keith. Thank you, Kevin. Kevin's already, I'm absolutely so excited to be here. I'm bursting at the seams. And I love what Kevin said. We are wherever the pulse of nursing is, that's where we are. And I have followed you guys for a long time, and it's just such an honor and a privilege to be on your show, so thank you for having me.
Great. Well, it's our pleasure. And Kevin, Kev, you jump right in here, okay?
Oh, most definitely. Well, Vivien, let's just light this on fire because we have got a lot of questions, I'm sure, from the community, and I know you've got a few of those answers. So we always want to open up with where our guests have been, how they got to where they are today. And I think what would capture that, the essence of that, and we talked about this off the air, is defining the origins of your tagline, which is education, reform, advocacy, power. And so what does that mean? And how did that lead you here? You're, of course, the historical Vivien Mudgett out there.
Well, Kevin, my tagline says everything that I believe in right now and why I started the Healthcare Leadership Coalition. And I actually started it a while back as it was called the Healthcare Policy Coalition. And then I changed it to the Healthcare Leadership Coalition because I realized that there were gaps not in knowledge, not only in the Affordable Care Act and in health policy, but also in nursing leadership. So let's start with education. As you can tell, being in the doctorate program, and you're right, I have so much spare time, I don't know what to do with it. So my friends think I'm nuts, but I signed up for a doctorate program at Rutgers. I'm very excited. And I believe in lifelong learning. And nurses, I think, have a need to be lifelong learners. But education comprises not only healthcare providers, but for me, also patients and consumers. When I first started this company, I realized that there was a big gap in what people knew about the healthcare reform era, about the Affordable Care Act, about what healthcare is today, and certainly a huge gap for leaders, for nursing leaders. There's a lot of nurses who are promoted into nursing leadership positions, and they are promoted like I was because we're good clinicians, but we don't necessarily have the skills that we need to be able to practice as a good leader, the delegation, the decision making, the conflict management, those things. So that's the education piece. The reform piece has to do with, obviously, the healthcare reform era that we're in. And they connect because without understanding the healthcare reform field, without understanding where we're at, you can't advocate, which is my next tagline word. You can't advocate, you can't teach, you can't help your patients, you can't help consumers. And power, just to me, education is power. Information is power if it's used correctly. But the most important thing for me is coaching, teaching, and allowing other people to learn and grow. This is a very turbulent time in healthcare, and most people think it's an awful time to be in healthcare, but I happen to think it's a life-changing time to be in healthcare. There's so much opportunity if you look for it, and there's so many ways to advocate, and there's so much that we can accomplish at this point. And so that's how I got here. I was in management for a very long time. I continued my clinical skills. I still do. I still practice at the bedside, and I love nursing. I love this profession, and I wanted to give back, and this is my way of giving back: to teach, to educate, to coach, and to help the public and help nurses.
Wow, well, that's a big umbrella to work under, Vivien. So it doesn't sound like you just work with nurses, you work with leaders. And you've said in some of our conversations and things I've read that all nurses are leaders. So can we talk about effective leadership for a second? Like say a nurse is promoted into a leadership position, like I've been over the last year or so. So what is it that makes a nurse able to move into a leadership position and actually be effective? What does that actually mean?
Well, let's start with my thought that all nurses are leaders. You know, we are coaches, we're preceptors, we help our patients, we give out information, we actually we delegate, and some charge nurses actually, obviously lead a whole team for the day. So every nurse is a leader in some way. We are one of the most trusted professions, one of the most ethical professions, year after year after year. And so the public looks to us as leaders. So let's start with my feeling that all nurses are leaders. The other thing that I want to make sure that nurses understand is that it's our responsibility. It's in our scope of practice. It's in the code of ethics that nurses need to be leaders of some kind. And that doesn't mean you have to be in a management position. It just means that the public looks up to you, and we have a social responsibility to stay informed, to be informed, and to lead. So what makes an effective leader today? An effective leader today, Keith, has to be absolutely informed about what's going on. Again, that's my education piece. You know, if you don't know what's going on in healthcare right now, you can't lead, because nurses are fried, they're burnt out, they don't understand what's going on, and leaders need to be able to communicate to nurses what is going on, why are we feeling the way we're feeling, what's going on around us. Leaders need to be flexible and adaptable, because, as we know, the healthcare field is changing on a daily basis. Every day there's some new mandate, something new that comes up, and so we need to be flexible, and we need to be adaptable, and we need to be very effective communicators. You know, communication has always been important, but it has never been as important as it is today. And I could do an entire show on communication and how important that is. Nurses need to be, if they're in a leadership position, they need to know how to make effective decisions. They need to know how to engage their staff. And especially right now, one of the things that nursing leaders need is the understanding of generational diversity. You know, we have about 4 generations of nurses working right now, and each one of them comes from a different perspective, and that's another show, Keith, by the way, generational diversity.
Wow.
So leaders, there's a lot of skills that they need, and that's why I'm doing what I'm doing, and why I do seminars on, I do 2-day seminars on what's needed as a nurse leader today, because it's not easy, and the things that got leaders to where they are today are not the things that are going to get them where they need to be in the next few years.
Well, you know, Vivien, I love your point that we, as nurses, we owe the public. It is a public disservice if we are not allowing ourselves the opportunity to be leaders within our nursing careers. I mean, we really do need to put ourselves out there. But, you know, in your opinion, I just wanted to ask you what your thoughts are. Are we ready for that leadership? Are we ready for change? What's going on in the paradigm shift, and what's holding us back? Are we holding ourselves back, or is it a combination of the system that's holding us back, you know, along with ourselves? What are your thoughts on that?
Well, Kevin, that's a multi-part question, I think. First of all, are we ready? We may not be ready, but we don't have a choice. We either have to move forward, or we're going to be left behind. And that's the way things are right now. So we have to, as nurses, be ready for the changes that are happening and the changes that are coming. And the other part of your question, what are the barriers? I think it's a combination. I think it's a combination of nurses not really having a lot of the resources that they need from management, from their leaders, to be able to get involved. But I also think it's nurses feeling powerless, nurses feeling like their voices aren't being heard, and also nurses being so busy in their everyday activities that they are feeling like they don't have time to devote to health policy or what's going on. But again, I honestly believe that unless we change, and unless we learn, and unless we grow, we are going to die. As a profession, our voices need to be heard, and I'm very, very passionate about that. I just wrote an article about where are the nursing voices. There's 3.1 million nurses in this country. There's 7 nurses in Congress. representing all of us. And a lot of decisions are being made about our practice at the bedside without the nursing voice there. And that's a shame. We need to get involved. We need to become the voice. We need to get onto task forces. We need to learn how to write a letter to a congressman. We need to be involved in whatever way we can so that our voices get heard. There's a wonderful book by Suzanne Gordon called From Silence to Voice.
Great book, yes.
Yeah, and that book changed my life, honestly, because that really helped me to understand how important it is for nurses to really speak up. And you don't have to become a nurse in Congress to do that, and you don't have to become a legislator.
That's such a relief, Vivien. Oh my God, I'm so relieved that I don't have.
Anything else to make you run for Congress?
I was starting to feel a little anxious there for a second. Thank you for clarifying that.
No, you know what? Little steps. You join your professional organization. They have an advocacy arm. For example, the American Nurses Association has an advocacy arm. So you can actually go online to the American Nurses Association or to your own professional organization, and I bet you they have a tab there that will say advocacy or something like that, and they have pre-written letters. They have a summary of all the issues facing nurses. They have ways, little steps that everyone can be involved. So really, it's not a huge undertaking. Little steps can make a difference.
Right, little steps. And there's so much for nurses to learn these days. And when it comes to reform, I know you talk about education reform, advocacy, and power. When it comes to reform, of course, we would be remiss to not talk about the Affordable Care Act. And I've written a little tiny bit, because I actually don't know that much about the ACA, but I've written a little bit about why nurses need to be informed about the Affordable Care Act and how it's going to keep impacting our practice for years to come. I mean, until it gets reversed or something changes, the ACA is really here to stay in healthcare. So you're very knowledgeable about the ACA. So if we just want to go there for a second, because this is kind of the legislative area, you educate nurses and lay people about it. What do nurses really need to know? Where do we need to send them so that they can begin the process of becoming at least conversant with the ACA?
Well, Keith, first of all, I want to make sure that nurses understand that the Affordable Care Act has been buried in political rhetoric. And we need to separate the Affordable Care Act, the Patient Protection and Affordable Care Act law, from all the political, Republican, Democrat, left-wing, right-wing, all that talk. The Patient Protection and Affordable Care Act has a focus on keeping people healthy. It has a focus on let's not just worry about treating the sick. Let's worry about how are we going to control costs. And you know, a lot of people hear decreasing costs and they think that immediately we're going to reduce all the nursing population and we're going to cut costs in places that they don't need to be cut. The Affordable Care Act has gotten a lot of you know, it's about 2,000 pages, and there's a revision that's another 1,000, and I think I know 3 people, including me, that have read the entire thing. And I was talking to a physician the other day, and he and I agreed there's about 1,000 pages that are awesome, 1,000 pages that we could change, and there's maybe 800 pages that we don't like. So, but it's a beginning. You know what I mean? We all knew that our system couldn't stay the way it was, and it's a beginning. So it's not perfect. It is not perfect. But the focus is on value. The focus is on patient safety, patient quality, patient access, and obviously insurance for people who haven't gotten it before. But I think that the focus is really good, and it gets lost in the political rhetoric. So I always want to separate the politics from the actual law. And I want to make sure that people understand that you may like it, you may not like it. It doesn't matter. But whether you like it or not, as you said, until something changes, we have to work with it, right? So at this point, nurses, they need to understand it. So, you can go to the Kaiser Foundation online. You can go to the Robert Wood Johnson Foundation. There are a lot of very good websites that are nonpartisan, which actually are on my website, healthclc.com. I have some links and resources to nonpartisan websites because I want to make sure I keep politics out of it. The most important thing for me as a nurse is the patient, the nurses, consumers, not the politics of it. So nurses need to first go online and learn about it. It's not just about everyone getting insurance. It's not just about keeping your kids on insurance until they're 26. Those are great things, but there are provisions that allow women some health services, preventive health services that they never had. There are provisions that have to do with reimbursement to hospitals, and that affects nurses at the bedside. A lot of times nurses will say to me, well, I just want to take good care of my patients. I don't really, I don't care about all that Affordable Care Act stuff. Well, you know what? The reimbursement to a hospital really affects our care at the bedside.
It does.
We have to get educated about it, and we have to know all the different aspects of the law. And again, Keith, so that you don't get overwhelmed too, you don't have to be an attorney, and you don't have to read 3,000 pages. There are many really good websites that have just a timeline and just bullet points about what the Affordable Care Act means and what's getting implemented when.
Well, Vivien, I just wanted to quickly interject here and we have Andrew Lopez with us, and just wanted to welcome Andrew here. And I know he's often talked about this with nurses out there. And of course, we have the ethers, we have the grapevine, which is technically now Twitter, Facebook, and Google Plus and the like, social media in this day and age. Nurses are concerned about their jobs. Nurses are concerned about the future of nursing. Now, we don't want to necessarily be self-serving here because we are here for the patient, but what does the ACA mean for nursing jobs? Is this a good thing?
Well, it is a good thing. It is a good thing. And hi, Andrew. It is a good thing because I know that nurses are concerned about their jobs, but first of all, both the Affordable Care Act and a report issued by the Institute of Medicine in 2010 both support and strongly encourage more jobs for nurses. It encourages scholarships for nurses who can't afford to go to school. It encourages nurses to practice to the full extent of their scope of practice. It encourages roles for advanced practice nurses. It encourages roles for informatic nurses, for innovative nurses who can help move along change. And it encourages, there's going to be a lot of jobs open for ambulatory care nurses, because let's remember that the Affordable Care Act is really focused on chronic diseases and preventing hospitalization. And so a lot of the care that we're used to giving in the hospital will be prevented by being able to control chronic diseases like congestive heart failure, diabetes, things like that. So there are going to be a lot of different jobs for nurses. It's a good time to be in nursing, and I don't think it's a time to be scared. However, I think it is a time, and I can't say this enough, as you can tell, it's a time to get educated about what your options are and where you want to be. But direct care nursing is not going away. Direct
Yeah.
care nursing is the heart of what we do as nurses, and it's not going away.
Right, and where that care happens may be changing over the years to come, and we're seeing it change. And Vivien, since we're talking about change and leadership and sort of the direction of the profession, can I just throw a question out there for you for a second?
Sure.
I'll need to sort of set the stage for it for a second. So what I'm seeing out there when I'm talking to nurses, so I talk to a lot of new nurses, novices, nurses who are just getting into the profession. Maybe they don't even have a job yet, or maybe they're in their first year. So a lot of us are seeing that for these new nurses, they realize there aren't really that many hospital jobs out there. So when they apply for the few hospital jobs that are there, they're told, well, you really need 1 or 2 years of med-surg experience to get this job. So they think, okay, I'm going to look elsewhere. They look elsewhere, like ambulatory care, home care, etc. And those people say, well, we could hire you, but we really want you to have 1 or 2 years of med-surg experience. And what I'm starting to see is that, well, all of these nurse leaders, managers, hirers, recruiters out there in the world have not caught up to the reality that the hospital jobs are drying up, and we actually need to embrace the fact that a lot of newer nurses, novice nurses, need to be brought into the profession not through that golden doorway of 1 or 2 years of med-surg, that we need to apprentice them and mentor them in what we might feel are, in the old days, were not appropriate settings for new nurses, but those new nurses aren't getting the med-surg jobs anymore. So what would you say to the leaders out there who need to hire these nurses for jobs without the 2 years med-surg, and what would you say to the nurses who are looking for the jobs and are frustrated because they're coming up against this, what I see as a very old world way of thinking? Does that make sense?
Yes, Keith, that makes a lot of sense, and I hear the same thing as I go around the country from newer nurses. Where are the nursing jobs? I hear there's a shortage, and I can't get a job. And I think that you said something very critical, is that nursing leaders now have to start having a paradigm shift as to what they look for. One of the things that I'm very excited about is the number of nurse residency programs that are starting to crop up in the country, where they hire a brand new nurse into, let's say, an ICU unit or another unit, and OB, something like that, where it used to be that you couldn't get into those jobs without 2-3 years of med-surg or whatever, but they're hiring brand new nurses right out of school and putting them through an intense 3 to 6 month residency and teaching them so that they can come out of that residency program and be an effective nurse on the unit. And I'm very excited about those programs, and I support those programs wholeheartedly. I also think that nursing schools need to also, not just nursing leaders, nursing schools, I think, are changing the way they're thinking, and I think they need to change some of the way they're teaching, because some of their programs have to be shifted to public health, the community, ambulatory care again. But I do think that it's frustrating for new nurses, and I do think that there are, a lot of jobs out there that are not being filled, and leaders do need to look at new graduates for those jobs and change that paradigm. Nurses coming out of nursing school are very capable of, very skilled and very smart, and very capable of learning. They just need to be taught. And so the older nurses and the leaders need to be able to take them under their wing and coach them and teach them and mentor them. It's really very important right now because many nurses from the baby boomer generation are leaving nursing, or they're going on to other jobs, the 12-hour shifts. after a while, they, they're exhausting for the older nurse, and I don't mean that in a mean way. I do them myself, and after a 12-hour shift, I'm done for 2 days. But also nurses my age are moving to teaching. They're moving to ambulatory care settings. They're moving to other areas in nursing, informatics, and the newer, younger nurses are going to be the ones that are going to, I always say, take care of us. So we need to get them in. We need to coach them. We need to teach them, and we need to get them in practice.
I agree, Vivien. I was actually part of a residency program at Johns Hopkins. So fresh out of University of Colorado outside of Denver, I flew to Hopkins to interview there, and immediately I was welcomed with, I felt, very savvy nurses, a very savvy and I would say supportive team. Like I knew, like this was a big step because this was cardiothoracic surgical ICU. This was not just your run-of-the-mill bypass. This was heart, lung transplants, VADs, very technical stuff. And their residency program was very intense, but it was also very supportive, and they wanted you to come out on the other side very successful. And I did, and many of us did. And so I appreciate that you were very supportive of that. I certainly am as well. But what I wanted to do is shift away from that topic just quickly, because I think you're leading into that as part of what you were saying in the last few sentences here, because Andrew Lopez did pose a question about, so Donna Cardillo is saying that there's a shift from care in the hospitals to the community, and that this shift started about over 10 years ago, and of course Obamacare is really getting a lot of the press. Now, of course, I certainly have an answer to that based on the growth of my company, but I would love to hear what you have to say as far as the community-based care that nurses are now seeing, or at least we're starting to get at least a whiff of that at this point.
So your question.
So my question is, do you see that shift occurring from hospitals to the community based on what you're seeing in the ACA and all of the literature out there and the news that we're seeing? Are you seeing a shift from the hospital to the community?
I definitely am starting to see a shift. I agree with Donna. I think this started a long time ago, and I think that the Affordable Care Act is getting some of the press for that. Maybe it was the impetus that people needed to see it happening, but there's definitely the rise of ACOs, and ACOs are, all they mean is that there's a coordination of care from the hospital to the community, and I'm seeing a lot more focus on public health, on population health, and definitely on the management of chronic diseases. And that is all done in the community. Is that your question?
Well, I agree with that. I just wanted you to answer because you're obviously our guest. I certainly have hard data to say with a resounding yes.
Yes.
Because my company, we do provide community-based care, and it's continuing to grow. Like there's no ceiling. I haven't seen any ceiling thus far as what my company can get involved with when it comes to the community, and especially because people ask me, how's the Affordable Care Act working for your business? And I say, we have to turn people away. We go through hiring frenzies. We look at contracts, and we help as many people as we can help, but ultimately that's where the care really is driving into that direction, because hospitals are either bursting or they've had to make cutbacks so that they can't take certain patients or what have you. Nursing homes either can't be built fast enough, or people don't really want to go to nursing homes or rehab centers. They want to rehab at home, or they want to be at home. And there are dollars, there is funding out there, federal and state level funding, that allows companies to come in and provide those types of supports directly to the patient. So it exists, but like I said, it's not about me. I just wanted to see what your opinion was.
It does exist. You're right, and I also agree that patients want to be home. They want to be at home, and they want to rehab at home. There's certainly a push. I know Andrew is very much into palliative care, hospice care. There's so much more of an understanding that people would really rather be at home and be taken care of in an environment that they feel comfortable in and they feel cared for. Um, and nurses can help to do that by providing resources for their patients. Uh, that's part of the educational piece, knowing and understanding what resources are out in the community for your patients, and helping physicians understand what the resources are, because physicians also need to catch up with what's happening. So, yes, I think there is a resounding yes and no ceiling, no. And I think that will continue. I think that community care, public health care, and being out in the community will continue and should continue, because who wants to be in a hospital? If you don't have to be in a hospital, it's much better not to have to be.
That's a great point. And you know, there are a lot of nurses like me, like myself, who really don't want to work in the hospital. And I've managed to not work in the hospital for 18 years, which has been my professional career trajectory choice. Kevin went to Hopkins because he really wanted that experience. I avoided the experience at all costs. But like we said earlier, there are all these new nurses out there who may or may not want hospital experience, but you know what? They may not be able to get it at all. So these healthcare leaders out there that you're actually actively educating and informing and empowering, get the message out there, Vivien, that you know you can hire the most savvy nurses out there, the new nurses, and bring them into the profession through what we used to think of as the back door, but it's just a different doorway now. And you know, with the baby boomers aging and the silver tsunami that we've all talked about on this show several times and we keep hearing about, and you're right, a lot of these older folks, you know, who are slightly older than me, for instance, 60s, 70s, 80s, they want to do their nursing care at home. And I keep catching wind of, you know, nursing home care being, that level of care being provided in people's homes, and that's the movement. And I think there are lots of nurses out there who would love to do that kind of work, you know, working one-on-one with a client in their home. You know, you're not in a facility. I think a lot of nurses out there love that kind of interaction, you know, where you could really intimately talk with a patient without the distractions of being, say, on a med-surg floor. It's a really lovely way to practice. I really enjoy it myself. So along those lines, Vivien, for the seasoned nurses out there, the ones who are, you know, say they've worked in the hospital for 25 years, for instance, and they want to move into the community, say they want to either work for a home care agency or some sort of case management agency, or maybe they want to do something on their own and hang a shingle themselves. What would you say, what are some of the important things they need to bear in mind and educate themselves about if they want to move out of that inpatient space to the more outpatient space?
Well, we come back to my cornerstone of education, Keith. Nurses who want to move from one practice setting to another need to educate themselves on that practice setting. And they may have to go back to school to practice some of the things that they want to practice. There are a lot of educational opportunities and programs out there for nurses who want to go from to a BSN. Certainly I support nurses going back for their degrees. You can tell by the fact that I'm getting a doctorate, but it's not education just for education's sake. It's the fact that evidence supports that nurses who have a BSN, nurses who move forward in their education, give a higher quality of care, and patients have a better outcome. And that has been proven over and over again, starting with Linda Aiken and going through other nurse researchers. But I certainly think that the only way to move into some of those careers that involve outpatient care, case management, things like that, informatics, being out in the community, public health, is going to take some education, and nurses are going to have to realize that they have to come out of their comfort zone and move into another zone to learn something new. And that isn't easy. I get that, but we have to do it. And there are a lot. I want to acknowledge that there are some nurses who are leaving the inpatient world, not just because they're baby boomers, not just because they can't do the 12-hour shifts anymore, but nurses have they're burnt out, they're stressed, partly due to the system, in the sense that they don't really understand and haven't been taught why things are happening around them. And partly also because right now all they see are a lot of graphs, a lot of charts, a lot of checklists, and a lot more to do with less time and with less resources. Mm-hmm. And they feel that their care has been minimized to nursing regulation by CMS or by whoever the federal forces are, rather than the patient. And that's where I also see a big piece where I and other nurses can help coach leaders and coach nurses to learn what to do, what to do to. That's where your voice comes in. That's where your advocacy comes in. That's where your every single. I really believe every single encounter that a nurse has is a healing. You're a healing presence, and you're an advocate for your patient. And I'm very passionate about that. And I believe that we have to speak up. We have to understand that, yes, we have to do checklists, but we also have to have time for patient care. And yes, it's important to practice evidence-based care so that we have quality of care, but it's also important to understand, leaders have to understand that they have a high turnover because they're not taking the time to coach and help some of their nurses understand what's happening around them. Electronic healthcare systems were designed with the best intentions in mind to really streamline communication between providers, and right now the truth is that most nurses feel that electronic health records are very cumbersome, and systems don't talk to each other, and systems are not compatible with each other. So nurses in the inpatient area, Keith and Kevin, are facing a lot of challenges, and they need a lot of support, and they need and this is another program too, is they need help getting back to their passion, back to why they started nursing, why they believe that they're in that profession, in this profession. They need engagement, and the only way to get engaged again is to go back to your why, and to try to make a difference in your own workplace. And that might be just by participating in the shared governance. That might be just by bringing an article about something that might help the rest of the nurses. It might be by leaders finding a way to help nurses with their burnout, their stress, help nurses self-care. Nurses don't take time to take care of themselves either. And so I really believe that there's a real, the nurses are being scrutinized more than ever. There's I don't know how many nurse-sensitive indicators that nurses have to worry about. And there's a real intention to leave nursing in the hospital, and I think that leaders have to be sensitive to that.
Well, we know all of this is certainly taking a hit, not only on the level of nursing when we talk about horizontal violence or lateral violence or nurse bullying. I mean, we've talked about it so much. Renee Thompson's been on the show a few times, and we've spoken to others. And obviously, I know this is a very close topic for you based on your thesis on bullying and this disruptive behavior. Obviously, this disruptive behavior, it's a ripple effect throughout the whole healthcare system. I mean, it definitely is felt not just from the nursing aspect or just as an employee, but really throughout the whole aspects of healthcare, because it really can drive us in one way or another. Most likely not in a good way, that is, when we're trying to really have good patient outcomes. And I know that can even affect patient outcomes. Very scary to think about that at that level. Will this extra education help that? I mean, will that help nurses find another level of not only themselves within the career, but just themselves as a person with this violence? I mean, can you take us there? Can you steer us in that direction? Is what we can do with this nurse bullying? How can we remedy this?
Well, you've touched a topic that is very close to my heart and that I'm very passionate about, and I'm very good friends with Renee Thompson. And I did my master's thesis on disruptive behavior. And you're so right, Kevin. It affects all of healthcare, and it's not. There used to be a saying, "Nurses eat their young," but it's not just the young that are being eaten. It's nurse to nurse, nurse to physician, physician to nurse, EBS to nurse, patient to nurse. And yes, it does affect patient safety. When I'm afraid to call a physician in the middle of the night to give him a critical result because the last time I called him he yelled at me, yes, that affects patient safety. If a nurse is bullying me and I go into a patient's room, yes, that affects the way I take care of that patient. So to answer your question, education will help with that, but what has to happen is nurses have to stop normalizing bullying behavior, and you've probably heard that from Renee as well as from other people. The number one reason that it exists, there's actually two that I believe in. One is that we normalize it and we say, oh, that's just Nancy, she's having a bad day, she's always like that. We have to stop normalizing, and we also have to stop being afraid of retaliation. We have to speak up, and we have to say enough, or my whole thesis was on scripting interventions, and nurses who learn how to address a bully do much better because they know what and how to say it. And I do some workshops on that, and so does Renee, and so do a couple of other people. But nurses have to learn to address a bully, and they have to be able to speak up and say, you are screaming at me in front of the nurses station, and that is not respectful or acceptable behavior. So when we can talk in a civil tone to each other, we can come back to this conversation. Or they can pull someone aside and say, when you yelled at me in front of the patient, it diminished not only my credibility in front of the patient, but it humiliated me. Was that your intent? There are many, many ways to address it, but it has to be addressed.
Right, and we've had Renee Thompson on the show a couple times, and Susan Strauss as well, who talks about harassment.
Yeah.
And the difference between harassment and bullying. And I'm actually working on an article right now for a news service I write for. So I'll share that with you when it's published, because I'd love to have feedback on it. It's a short blog post. But I wanted to move on a little bit, Vivien, because we're running out of time. Just in terms of your business, the Healthcare Leadership Coalition, and what do you want to tell us just about briefly in that organization, what's happening, or anything you have planned, or anything you'd like to share in terms of where the HLC is headed right now?
Well, the Healthcare Leadership Coalition is starting to get very busy, and that's a good thing. But where we're going and where my whole all my dedication is on teaching patients, consumers, and healthcare professionals about changes and trends in healthcare. So I have seminars that are coming up. They're going to be on the website very soon. I do a lot of coaching for hospitals and individual organizations. And again, I'm a nurse, so to me, the patient is very important. And so I have two blogs on my Healthcare Coalition website. One is directed at healthcare professionals. One is directed at consumers and patients.
I see that.
I'm sorry?
I see that. Yeah, that's great.
Yeah, because, we assume that they are going to be reading and they're going to be knowing what we mean and what we want and what we're doing. And, healthcare literacy is, again, another huge topic. And all patients do not understand everything that's going on and are at a loss. So are caregivers. We have a generation of caregivers who are taking care of their parents, and they don't know where to turn for help. They are so confused in the system. And so really my whole goal is to help everyone be a healing presence, and to help patients and help consumers and help physicians and chief nurse executives and new managers and CEOs. It doesn't matter who you are. There's something to learn about leadership, the Affordable Care Act, and again, the disruptive behavior that happens.
Wow. Perfect. Well, Vivien, I'm following you on Twitter, LinkedIn, Facebook, Pinterest, and Google+, and I encourage everyone to go to healthclc.com. That's healthclc.com. Definitely sign up for the blog. There's 2 blogs. If you go to the bottom left-hand corner, you can follow them and follow Vivien on all of those social media platforms, and there's lots of great information there. And Kevin, do you have any last question or comment before we wrap up and say goodbye to Vivien for this particular episode?
Well, just that it has been a pleasure, and I think, again, really informative, because this whole ACA topic has obviously created a ripple effect through us as a profession and as professional organizations. And I think at least getting closer to some of the answers that we feel are still sort of outlying there that we need answered, and that would be really what is the future, not only from the consumer level. We hear, you're right, we hear all about health insurance and getting covered, but really what does that mean for us as nurses and for our careers? And I just think if you're looking to diversify and sort of jump on board with this paradigm shift, now's the time to do it, because I think the ACA is definitely supporting that paradigm shift. And we just got to get on board and as a collective get moving in that direction.
Absolutely, and I want to thank you both very much for having me on the program. It's, again, been an honor and a privilege, and I feel like this hour just flew by, and there's so much more to say, and there's so much more to talk about, so we'll have to hang out again sometime soon. But,
we'll have you back, Vivien, for sure.
Oh, thank you.
Yeah. Well, thank you so much. You have a great day, and we'll be in touch. And this episode will be archived, audio and video, so people will be able to catch it after the fact, and it'll be up forever. So you'll have a special page on rnfmradio.com as well. So thank you so much for being here, Vivien. It's really a pleasure. You're an inspiration.
Thank you to both of you. You are too.
Thank you. Bye.
Thank you.
Bye.
So, Kevin, I wanted to ask you, because you own a business and you hire a lot of nurses. So I wanted to ask you the question. I know the answer, but I want you to tell our audience. What do you think about, those savvy nursing students who are graduating, who need to get out into the profession, can't get a med-surg job, and, they shouldn't have to get a med-surg job in order to work. So what do you think about people like you and different ambulatory care agencies bringing in those new nurses and mentoring them and really showing them what nursing's all about?
I think as long as the organization has enough of a sort of a savvy collective of healthcare professionals, an interdisciplinary team that we can train those nurses, I don't see why they wouldn't be successful. I mean, essentially, we do work with new graduates on various levels because there are various levels of care that we have to provide to the patients. Mm-hmm. And just like Vivien and I were waxing poetic about residency programs, and Johns Hopkins was a great example that I spent 6 months in a very intensive program there to learn that level of care. We can certainly do that in the community. Like I said, as long as we have nurses that are willing to teach, which obviously when we talk about education and adding degrees and levels of certification to do that, but also experience as well.
Right.
If the support system is there, the success will follow.
Right. And we also, it's not just, in my mind, I was thinking on simple terms, like, oh, you bring in these new nurses, you put them in an ambulatory care setting, and you make sure they can fly, But the other part, which is the leadership part that Vivien talks about, is also making sure that it's the nurses, not necessarily that are in actual leadership positions, but you teach and mentor the experienced nurses how to teach and be mentors, how they can be leaders. Because if they're not prepared to mentor these new nurses, then the new nurses aren't going to get the grounding that they really need. So it's very multifaceted, and I feel like there's a lot of folks out there, and I know I intimated this earlier in my first comment to Vivien, that it's sort of an old world view. It's like, oh, you don't have your 2 years med-surg experience, you're not going to work here. And we need to subvert that paradigm. There has to be a huge sea change so these new nurses can feel welcomed, and they can feel like, yeah, actually I am valued coming in here even though I don't have those 2 years of med-surg, that I have something to contribute. And I see a lot of nurses going through nursing school who come from amazing backgrounds. Maybe they weren't home health aides or CNAs, maybe they were marketing executives, or maybe they did all sorts of things. And there's a lot of skills that those new nurses have that we can tap that maybe don't have to do with healthcare per se, but they can be leaders in their own right from the beginning, even though they don't necessarily have healthcare experience. Do you know what I mean when you bring those new nurses in?
Well, I agree, and it also has to do when you're talking about the bullying and leadership and really kind of sort of penetrating this concept of change and the shift and whatnot. I think also it also is related to the environment. For example, I know that with what we do within our company, everybody loves their jobs.
Mhm.
They better love their job, but no, they tell me they do. But when your environment allows the opportunity for you to be successful individually, you want to share that success. It's like infectious because the new nurses and the new team members that we have coming on board, we want to teach them. We want them to be as successful as we are and have as much fun providing the nursing care pretty much as we had always hoped as nurses. So
Right.
it does, from Vivien's standpoint and leadership, like leadership, like actual like title leadership, I would
Mhm.
say that as long as you've got that backbone there to help support that and give that a little bit of breadth, then I think that that'll also carry the success for the individual nurse.
That's a really good point. And that comes to this notion of across the board support, and this notion that nurses can support each other and support each other's learning, and that there's not resentment of the older nurses, that there's not toxic resentment of the newer nurses, like they're a burden and we have to teach them, and they take so much time and trouble. We all have to see how it benefits everyone, and it's that sense of collective and that sense of collaboration that you and I always talk about. And it's real. It's not some pie in the sky thing. I mean, patient care is collaborative. I mean, the best patient care anyway.
hmm Well, and I just wanted to make a point because Andrew had been sort of lighting up the Q&A here, and I
Mhm.
wanted to at least address one of the blog posts that he had mentioned about. I think it was from Kevin MD at kevinmd.com, something about up to a third of the hospitals may close by 2020. Now, I'm not exactly sure. I'd have to read the blog post. I haven't, but part of me says fine, and but let that be known that it's not that I'm not concerned about your job, but quite frankly, there are jobs out there. There will be jobs because if a third of the hospitals close, do the patients go away? No.
Mhm.
These centers, these ancillary centers, we still have to have surgery. We still deal with traumatic injuries. and what have you. We still have to treat people, but that can be carried out in the community. And there are organizations like mine and several others out there. So you don't have to be an entrepreneur. I'm not saying that you all of a sudden have to switch gears and say, well, I've got to, hang my own shingle. I've got to be a business person. No, not exactly. But just know that there are plenty of companies that will fill the gap. We have to, because the patients will still exist. The patients still need our care. So just tweak the thinking a little bit.
That's right. And the population will keep aging. We know that's the case. We know that the baby boomers will keep retiring, and we know that they're going to need the care, and they're a savvy bunch, and a lot of them are going to want to stay at home as long as possible. So whether you're hanging an entrepreneurial single or not, or you're working for an organization like yours, that's where the money's going to be. It's where the jobs are going to be. And it's this paradigm shift we were discussing with Vivien of the leadership and the management and the people who are hired, who do the hiring, the recruiting, need to realize, there's a lot of nurses out there we can pull into this fold, and we just need to give them the training and mentoring they need so they can do it. And it's a huge change, and nurses keep telling me, I can't find work, and I keep telling them, look, it has to change. Things have to change. There has to be work out there for you, but it might not be in the place where you think it might be. And I wish we could reach all those managers and recruiters out there and give them a piece of our mind and let them know that there's a lot of savvy young nurses out there that we need to give opportunity to, because they're going to take care of us in 20 years.
Right. And again, simply put, the jobs aren't going away. It's just a shift to another platform. Right. That's all it is.
Exactly. Yeah, that's a really good point. I really like that. And I'm just going to drop a dime here about what I mentioned to Vivien, the article I'm working on right now for Multi-Briefs News Service. We've heard of horizontal violence. We talk about bullying and horizontal violence. I'm writing about horizontal kindness, what it means to bring compassion and kindness across the board. What does that mean to share that instead? So it's just sort of a terminology I'm working with, and I'm going to get that article out in a couple days. So that sense of support and collaboration, that is that horizontal plane along which we all walk. And if we can create more of the sense of collaboration and cooperation, I think it benefits everyone. I mean, there's no one that it hurts. It has across the board benefits.
Agree. Yeah. So yeah. I don't even know where we could take this, but yet another show. So I guess that's everybody's going to have to stay tuned for the next episode here. So
very true. Very
informative, very eye-opening, and I think it answered a few questions. I think Vivien answered a few questions, and ultimately I think that is key, that is essential for our community, so that they know there are some answers out there, and there are folks out there doing this. So
that's right.
It's real. It's possible. Pinch yourself. You're not dreaming.
That's right. And Vivien was great. We encourage everyone to visit her website, healthclc.com. Find her on Twitter, LinkedIn, Google+, Facebook, everywhere. Connect with her, follow her, see what she has to say, read her blog. It's really worth following. She's a wonderful leader out there, and we really want to make sure people know all about her. Her page and her podcast, this podcast will be up on our website in a week or so watch for that. And I'm Kevin. I'm going to wish everyone goodbye, and we'll have many more shows coming your way throughout the summer. I've been booking more and more guests into the fall now, so just watch the calendar at rnfmradio.com. So Kevin, I'm going to let you wrap up. Take it away, and thanks for another great conversation and a great show.
Great. Well, I know that the needle has moved for me today. I'm going to continue to stay uplifted and motivated. Innovate, create. I'm going to continue to find passion in everything that I'm doing day to day in my career and in my life. I hope you do the same as well. Stay with us here at RNFM Radio, rnfmradio.com, because we are hanging out on the pulse of nursing. So care for yourself while caring for others, and we look forward to having you back here with us again on RNFM Radio.